Hi, this is Dr. Redwin. In this video, I'm going to discuss about headaches and the reason behind that headache and what are the different types of headache which the dentist is going to encounter in his clinic and what is the role of a dentist in identifying those headaches and how to treat them. And mainly I'm going to highlight about the headaches because of temporomandibular disorder and how to differentiate them from other types of headaches. Most of the time, when I'm asking history to my patient, they always hide headaches. So towards the end, when I understand that they are been experiencing headache for a very longer period of time, I will question them, why didn't you tell me about your headaches? And they always doesn't have any answer for that question. The most possible reason behind that is they would have thought that dentist doesn't play a role in solving their headache issues. That is mainly because in our society, it has been formed that the headache specialist can be a neurologist or ENT specialist or an ophthalmologist, but not a dentist. So this scenario is not very right, and a dentist has a very important role in changing it. Because most of the conditions which give rise to headache can arise from the teeth or the surrounding structures like temporomandibular disorders or even muscles of mastication pathologies. So because of such complex condition which is being dealt by a dentist, the dentist is surely one of the headache specialists who can address your headache issues and treat them accordingly. One of the most common condition to create headache is sinusitis. Sinuses are air-filled cavities which is present in the craniofacial complex, and it includes frontal sinus, maxillary sinus, ethmoidal sinus and sphenoidal sinus. Together, these things are called as paranasal sinuses. Among this, maxillary sinus plays a very important role to a dentist. That is mainly because of the close proximity of the maxillary teeth root to the floor of the maxillary sinus. Because of this close proximation, whenever there is a pathology in the maxillary sinus, the pain will be radiating to the maxillary posterior teeth, especially the second premolar and first molar. Likewise, when patient is having any dental infections, any periapical abscess in the maxillary posterior teeth, in the maxillary second premolar or first molar, that particular pain will be radiating to the maxillary sinus also. Sometimes even the infection will be transferring from the odontogenic origin to the maxillary sinus. So because of this close proximity, dentist plays a very important role in identifying whether the pain is arising from the maxillary sinus or from the tooth. Because the entire treatment plan differs based on from where the problem arises. So basically, if it is a maxillary sinusitis, patient will be having a headache. Along with that, patient will be having pain in the malar region of the face or around the eye region. And patient will be having stuffiness of the nose, or sometimes nasal discharge will be present, or most of the patient will give a history of allergic conditions. Another type of headache is migraine. Migraine is a commonly unilateral headache which is of throbbing type, and it is commonly seen in middle-aged female individuals. It is also called as sick headache, that is mainly because the headache interferes with your normal routine activity, and patient will experience severe headache in this type. So most of the patients who has an headache for a longer period of time will be already diagnosed with migraine. Sometimes it would have been diagnosed by the doctor, or most of the condition the patient themselves believes that they have migraine because it has been not cured by any of them. So basically this migraine can be of two types. One is migraine with aura, another one is migraine without aura. This aura means some environment which has been experienced by the patient before the onset of headache. For example, if the patient is going to experience an headache, before some time, patient will experience some abnormality around the environment. That means patient will feel some pricking sensation in their hands and limbs, or patient will feel some muscle weakness, or some visual disturbances like some stars like formation or light which is being present in their visual appearance, which will actually be not present in that particular area. So when they experience that aura, they will understand that within some time they are going to experience a headache. So these are one group of migraine individuals who experience an aura before the headache. Whereas other group of individuals will not have this aura, directly they will experience a headache. So these are the two different groups of migraine individuals. So basically this migraine is a pathology which has been happening in the trigeminal-vascular system. So this complex includes some neurons which is arising from the trigeminal nerve and it's innervating the cranial vessels. So because of the inflammation which is happening, the patient will experience severe pain. Migraine can be diagnosed mainly based on the clinical examination, patient history, the presence of aura or the family history. Most of the time the migraine will be misdiagnosed as some other conditions or vice versa. That is mainly because unlike our maxillary sinusitis, which can be identified or confirmed with the help of radiographic features, migraine cannot be done like that. So because of that, what will happen is some other pain can be diagnosed as migraine and patient will be under that management for a longer period of time without any cure. The most common thing which happen like this is temporomandibular disorder. I have seen a lots of patients who is actually suffering from temporomandibular disorder is being diagnosed as migraine and they were under medication for many years. Temporomandibular disorder is a chronic condition which affects the TMJ region. So it is basically present in the preauricular area. So most of the patient will be having pain in the preauricular region whenever they are opening and closing the mouth. Since this TMJ is supported by lots of muscles which is called as muscles of mastication, most of the time patient can experience pain other than the TMJ region also. So they may experience pain in the lateral side of the head when their temporalis muscles are being affected. They can experience pain in the occipital region, that means behind the head or back of the head when their trapezius muscles are being affected. So some patients can experience pain in the top of the head also. So based on which muscle gets affected, patient can experience different types of headaches. So because of this complex pain which is present in the temporomandibular disorder, most of the time the temporomandibular disorder is being misdiagnosed as migraine or sometimes sinusitis also, because of which the condition will never be diagnosed properly and the treatment will always fail. So identifying the temporomandibular disorders is very important, especially when the patient gives a history of headache. So in my experience, I have seen lots of temporomandibular disorder patients who comes with a previously diagnosed condition of migraine, and they will also be under the migraine medication for many long years. So I have seen immediately after their management of temporomandibular disorder, they get resolved from their migraine. So from that, basically I understand that migraine is a condition which has to be diagnosed properly by excluding the temporomandibular disorders and other headache conditions. So temporomandibular disorders is one of the most common one which has to be find out mainly based on the patient's mouth opening or by examining the muscles of mastication. If that part is properly done, you can easily find out whether it is a TMD issue or it is a migraine. So your treatment protocol can be very successful if you go accordingly. There are other few reasons which can give rise to headache, and most commonly it can be because of your lack of sleep, dehydration, hypoglycemic headache because of excessive stress or increased blood pressure, or sometimes where it could be a more dangerously because of a brain lesion which has been growing in the brain, or it can be of any malignant condition also. So because of all this varied type of reason for the headache, patient has to go for a thorough investigation and find out the exact reason why they are suffering from headache. Especially if the patient headache is non-responsive to any normal analgesics like NSAIDs, patient has to be much more caution about that. Or if the headache is being associated with nausea, or it has been associated with any change in vision or day-to-day routine life, then patient has to be very careful about that. So understanding the physiology behind headache or understanding the mechanism behind that and the reason behind that is very important in avoiding many critical complications. So always understand the dentist plays a very important role in identifying them, because most of the conditions can be related to a dental findings which the dentist can identify in the early stage and can prevent the most complicated conditions also. I hope this video has been informative and useful for you. So if you like this video, kindly like, share and subscribe to our YouTube channel Diagnox. Thank you.